And businesses open up, many of us will still be required to physically distance ourselves and wear those face coverings. There's still, though, a lot of confusion about when and where to wear a mask. And Nurse Alice Benjamin joins us now with some insight on this. Thanks for joining us, Alice.
Thanks for having me, Carolyn.
Let's begin with the basics. What is the proper way to wear a face covering?
Right. So you want to make sure that you're wearing a face covering whenever you go out, especially if you're unable to practice social distancing, because sometimes when you go places it can be very crowded. So when you wear a mask, you want to make sure that it's covering your nose and your mouth properly, because you want to protect that airway. So you put some hand sanitizer on, make sure or wash your hands, and when you put on a mask, make sure that it covers your nose and mouth properly and it's secure onto your face, such as this. And so when you have it on like this, you can see that, like, if I were somewhere and someone's talking to me, that these droplets are not going to spray out anywhere because I'm wearing a mask. Now, a mask is, although we think of protecting ourselves, it's really, we should act as if we potentially have it and we're trying to protect others, because we know these droplets that carry the coronavirus can be spread through laughing, sneezing, coughing, and those type of things.
Yeah, so you're really being thoughtful and careful when you wear one. What about when you're driving in a car, or perhaps you're going outside for a walk? What about then?
Well, if you're going out and there's no one else around you, you don't really need to wear a mask. You only need to wear a mask when you are going to enter into areas where you may encounter other people who there's a potential that you might come closer than the 6 feet. So you wear the mask to prevent any accidental transmission. And I have to say this, Carolyn, when you're wearing a mask, you need to be very careful that you're wearing it properly. I can't emphasize that enough. And there are various masks out there, and people need to be very cautious that it's really covering your nose and your mouth and secure behind your ears. Because if these things are sliding down, they're not, that's only covering your mouth and not your nose, these masks won't be able to protect you.
We've heard about wearing bandanas, and those are sort of more loose fitting. Is that okay? Does that provide enough protection?
Well, I want to say it's better to have something than nothing. So I do have a bandana here. Now, this is a barrier, so if this is all you have, by all means, still wear it. The problem is that you have to tie a knot around the back of your head, and that can come loose when you least expect it. So if you have this, then you want to make sure that it's really snug when you're wearing it. But ideally, you would wear a mask that has some type of loop so it can be secure around your ear and less likely to fall off. And also, in selecting a mask, I have another one here. This is one you would tie to the back, but some masks actually have kind of loose wires, soft wires that you can actually wear, which can actually mold to your face, which is even better, because the more snug your mask is, the more of a seal that you can have around this area, the better your mask is.
Yeah, I found those to be the most comfortable, the ones that have that very light bendable wire that goes above the bridge of your nose. We know you're supposed to wash the cloth masks every day. How about if you have any of those paper ones? Can you reuse those? Can you spray them with Lysol? What's the deal with those?
Okay, very good question. So the disposable masks are really intended for single use. So if those get moist, wet, or soiled, you definitely need to throw those away because it's going to be compromised. Now, if you have a cloth mask, you need to wash these daily or even more frequently if these also get moist or soiled. That's going to be very important, because if you're wearing a soiled mask, then you're actually going to make it easier to contaminate and get infected. So you want to wear these your cloth masks daily, or change them more frequently if you're going to be in areas where you're potentially coming into contact with people, or they get moist, or they're visibly soiled.
All right, some great advice for us. Thank you, Nurse Alice. And if you have health questions, be sure to let us know. You can post them on our Facebook, Twitter, or Instagram, and use the hashtag AskNurseAlice.
Anyone else?